Hi, it's Beth from Navigating Healthcare Canada. I'm a spousal care partner for my husband, who is an immunocompromised senior, and we live with my octogenarian and nonagenarian parents. There are two main issues that I and other Canadians have when it comes to COVID vaccinations. As the youngest member of an older family unit, I am concerned by the difficulty I have accessing COVID vaccination in general and Novavax vaccination specifically. Vaccination is a necessary component of a broader COVID prevention strategy, and it shouldn't be difficult for us to access. I have spent significant amounts of time on the phone with the provincial gatekeepers of COVID vaccinations, trying to get special dispensation to be vaccinated myself. I'm 59, and in British Columbia, only certain groups were allowed to access COVID vaccination in the spring. That didn't include family care partners who were actually living with vulnerable family members. This is different from other vaccinations I have previously been encouraged to get, such as the flu shot. When the government response to COVID is vax and relax, why is access to vaccination throttled? So why Novavax? Novavax is the vaccine of choice for the immunocompromised and their family members for two reasons. It provides better coverage of variants, and it doesn't result in as many side effects, which can be significant for certain populations. Limiting access to Novavax was strongly discouraged by the National Advisory Committee on Immunization, NACI, who said public health programs should consider the impact of limiting access to only one COVID-19 vaccine platform on vaccination acceptance and uptake. Despite this, the feds have said they won't be ordering Novavax in favor of the mRNA vaccine platform only. In a recent response to a citizen inquiry about Novavax, the Public Health Agency of Canada cites low uptake as a reason why they are failing to order Novavax. So provincial governments throttled vaccination rates through restrictive gatekeeping policies, and then PHAC blames citizens for poor uptake and won't order Novavax. This is unacceptable. So what can we do? It's imperative that we 1. Let our elected provincial officials and public health people know that they need to improve access for all COVID vaccinations. And 2. Let our elected federal officials, public health, and NACI know that we expect access to Novavax along with the mRNA vaccinations from Pfizer and Moderna, and that this needs to be in conjunction with better provincial access to COVID vaccination. They need to hear from us. You can find a link to a Google Doc template written by Sparrow on Twitter in the video description below. Call, write, share this information on social media and with mainstream media.